I'm here with Mr. Carl Stanifer, CEO of SEHA. Hello.
Hi, good to meet you.
Nice to meet you. What are you discussing this year at the World Healthcare Congress Middle East?
I'm on two separate panels this year. One is a discussion of knowledge transfer, and the other is a discussion of public-private partnerships. And so I've just finished one panel this morning, and I have the second one tomorrow.
And why is it important to have such an event?
Well, healthcare is growing so fast around the world, and there's a lot that emerging markets like Abu Dhabi and others can learn from what's going on in more developed markets in Europe, the U.S., Canada, and Australia. So bringing together professionals from all these various walks of healthcare profession in a single forum, and especially in the panel format they use here, which gives the participants an opportunity to actually interact with the speakers and the panel members and ask questions. And this sort of activity provides a great foundation for people that work in other countries to understand what's going on around the world.
What are some of the challenges your organization is facing in the healthcare industry?
One of the, I would say our single biggest challenge is a very competent, qualified, and effective labor force and maintaining that.
So human capital. Human
capital. We have only, from our indigenous population, the UAE nationals, we're able to only staff about 15 to 18% of our positions. So that leaves us exposed to the risk of having to identify, recruit, relocate, train, culturalize the vast majority of our workforce. And it's even more difficult if we look at it from the clinical side, because only 2% of our nurses and doctors and lab techs and pharmacists are indigenous labor. And so it's constant turnover, and constant turnover results in quite a bit more difficult to sustain your quality processes and so forth, because you're always bringing in new workers. It's a very difficult challenge.
How is SEHA overcoming this particular challenge?
With great effort and not as effective as maybe we could be, and so we're constantly trying to restructure the way we do things. But for instance, we send recruiting teams to all over the world, and they will enter a market. They usually work with an employment agency in that market to do some pre-screening before we arrive. We'll interview hundreds of nurses, for example, in Manila. And then go through a process of testing, seeing if they qualify for licensure, seeing if they qualify for a visa here, and then finally, if we interview 300 in Manila and we get 15 or 20 actually come here and work, that's a positive outcome. So you can see how much effort, how much work has to go into it. We do the same thing with every other
So that
clinical
definitely
discipline.
affects cost?
It's a major effect on cost. It indirectly affects quality because more so not so much the recruiting effort as it is this turnover problem, because you invest a lot of money in recruiting, getting people here and training them on your systems.
Because they're not home.
Right.
Yeah.
Exactly. And you have to constantly retrain, and it's a much greater effort to maintain and sustain and expand quality than it would be, for instance, in other countries where I worked where I didn't have this problem.
What are some of the innovations your organization brings to healthcare?
A lot. For instance, I think the most important one to talk about would be our electronic medical record. I think we are one of the largest health systems in the world that has a single electronic medical record across our entire health system. So, and it's digitized completely, so it includes your ultrasound images, your x-ray images, everything. We can set up now, with this capability, we can set up a centralized physician interpretation center for all these images, for instance, so that we got 24/7 coverage, we got all the subspecialties. So as a patient coming into our health system, you can take comfort in the fact that whether you enter a very remote clinic in a rural area, or whether you come to a flagship hospital in the inner city, we know what happened there, and we know what meds you're on from there. We know what your lab results, so we don't have to repeat them the next time you come to another. So I think the single most thing we've done in innovation here is to move from a paper-based fragmented a medical record to a fully integrated electronic medical record. It's a big accomplishment.
And what's your opinion on the Abu Dhabi hospital rating system?
You know, it's new, and it's not been fully assimilated yet. I would say it's important that we have a hospital rating system. I think it's important to be transparent with our consumer market, with our physicians, and among the competitors, the privates and the publics and so forth. The challenge is to get a hospital ranking system that stands the test of time and is validated. The data that drives that is a validated data. And we're studying the data now from the first ranking report. And so I really commend the health authority for taking the initiative to move it to this direction. And we look forward to working with them to improve the data quality and the sustainability of the data that goes into that ranking system. It's a very important initiative.
Healthcare knowledge transfer is very complex. How can you ensure that knowledge transfer is effective?
It has to be evidence-based. I mean, it's many answers to your question, but there's a recipient of knowledge transfer, there's a provider of knowledge transfer. Both must go into this arrangement with common understanding of what the objective is and how we're going to measure the success of it. And so when I say evidence-based, we need to be able to track over long periods of time that we've actually changed behavior. It's not enough just to come and teach a competency. That's not, to me, that's training. That's not knowledge transfer. Knowledge transfer means changing the behavior of a cohort. It could be doctors at one hospital, it could be nurses at one hospital. But you have to change the behavior of that cohort to accomplish objectives that both the provider of knowledge transfer and the recipient of knowledge transfer have agreed on in the beginning and measure. So data, again, you get back to your question on the ranking system. Data is the key to everything. And integrity of that data is of utmost importance. And so if you've got the data, you can track the success of knowledge transfer. And it has to be done that way. It has to be evidence-based.
And how hard is it to get people to change the way they do things?
Just a little bit south of impossible. Especially, you know, we have over 100 different nationalities, speaking over 50 different languages, spread out over a huge geographic area. There's 17,000 of us, from the people that you know, keep our hospitals nice and clean to the people who do transplant surgery, and everything in between. So to try to focus on a massive behavior change it'll discourage you. I mean, find the quick wins, hire competent people, get the knowledge transfer that works, the provider that really knows what they're doing, measure your success, and then celebrate it. And gradually, you begin to get behavior change. But it's a generational thing. But get the quick wins first, and you'll see some positive feedback, and then that gets the excitement going.
Why does transfer of best practices often not work?
They're again always very difficult questions, or complicated questions, I should say. So I focus, at the risk of oversimplifying, I have to focus on sort of the high-end answer to your question. But I think it doesn't work most of the time because the objective of the recipient and the capability of the provider are out of alignment. And so the recipient's expecting one thing. Maybe the recipient hadn't done their homework, they're not prepared. The provider comes into a country that maybe they've never been in before. They don't understand the landscape very well. And they try to replicate the best practice they came from, rather than modify that best practice to local conditions, get the buy-in of the receivers, and then follow the process.
Customizing it to fit.
Absolutely.
So the expertise is there, but it needs to be
It's not
customized.
Plug and play, and this is what I think too many people think, especially the ones receiving best practice and knowledge transfer. They're looking for the magic bullet. They just want to plug it and play it. It never works that way.
Thank you very much.
Thank you.
Mr. Carl Stanifer.
Yes.
It was a pleasure speaking with you.
A pleasure speaking with you as well.
Thanks.
Thank you so much.